Welcome. My name is Dr. Catherine Antley, and today we're recording another episode of The Science of Effective Prevention. And today it is my honor and pleasure to welcome a very special guest from Colorado, Dawn Reinfield. Dawn Reinfield is the executive director of Blue Rising Together, and this is an organization which has worked for many years on issues which make it difficult to grow up in Colorado. In the past, they've focused on gun violence, but more recently, they're focusing on the harms and educating and warning the public about the harms of high potency THC cannabis marijuana. Before I give the platform to Dawn to tell us all the wonderful things she's been doing in Colorado, I want to do two pretty quick clips. One is Dr. Chris Rogers, who's a psychiatrist and medical director of a large psychiatric hospital, and the other is the Attorney General of Colorado. So we'll get both the medical perspective and the legal perspective, and then we'll hear Dawn's story.
I'm the medical director of Child and Adolescent Services at the Medical Center of Aurora, the largely non-publicly owned psychiatric hospital in the state. Here I'm an inpatient psychiatrist with a front row seat to the emerging epidemic of cannabis abuse and addiction that threatens to swallow the lives of a whole generation of Coloradans. On our adult inpatient unit, it's hard to keep count of the number of psychotic and suicidal patients that are admitted with THC on board. And regardless of the data or clear evidence of how cannabis contributes to their illness, person after person refuses to accept that marijuana could be bad for them. How could it be? They have been taught to believe this is a harmless plant, a medicine that is good for anything from headaches to cancer to anxiety. It's natural, without side effects, without risk of addiction. This is the lie that is ruining the lives of far too many people in our state. The story on our adolescent unit is even more tragic, as we repeatedly treat kids too psychotic to know what's real, who they can trust, or where they are. The rates of adolescent psychosis have grown steadily since legalization, and in almost every single case is linked to the use of high THC potency concentrates. Products known as dabs, or wax, or shatter that are made in a lab by distilling down the most psychoactive component of the marijuana plant and concentrating it into what is better described as a hard drug than the weed people voted for in Amendment 64. Kids as young as 11 or 12 are using blowtorches and glass rigs to smoke these highly addictive and harmful chemicals, sometimes every night just to go to sleep.
The rise in teenage use of high THC concentration marijuana is a critical public health challenge. It demands action, and it's important what's being done today. It is a model for the nation. Just consider the latest report from the Colorado Department of Health, Public Health and Environment in their Healthy Kids Colorado survey. They surveyed the use of dabbing, which has been discussed, a way of accessing high THC potency. It went from 4.3% of students in 2015 to over 20% in 2019. This is an alarming rise.
So Dawn, how did you realize that there was a problem, and how did it get your attention?
We started working on this in Colorado. I run an organization called Blue Rising, and we started working on gun violence prevention issues after the Sandy Hook shooting. And that's kind of where I learned a lot of organizing skills. And I also learned the power of parents wanting to make change out of things that they saw that was wrong, and how really parents coming together is an unstoppable force. So we started organizing around high potency THC because as a parent myself, I have teenagers, and I saw in my community how high potency THC was having dramatic impacts amongst teens, and that the legislators at the Capitol, most of whom did not have teenagers, many either have no children or little children or much older children, really were totally disconnected from how the policies that they were passing at the legislature were impacting their local communities. So having worked in this space for a while, we just started reaching out to legislators, organizing, and kind of saying, this isn't what you think it is, and your policies are actually having a really dramatic effect on teens. Kids were very easy, able to get it. It's inexpensive. They would just sell to each other, or it would be given to them. And the schools, when we first started our effort and with our lobbyists, we started reaching out to different groups. we met with the Association of Superintendents, and they said to us, there will not be one school district in the entire state that does not support this, because they were so overwhelmed with the problems of kids dabbing high potency THC and then all of the mental health effects that were coming from that, that there was so much support from organizations like in the education community and the medical community to join on to this very large effort that really kind of ran the political spectrum. Our organization, Blue Rising, has always been on the Democratic side of things. And one of the things that I feel like is a Democratic bedrock in our philosophy is following the science on COVID, on vaccinations, on climate change. And the argument that we made was, if you believe in following science, then you need to follow science. And that includes industries that you've gotten too cozy with. And that's what happened. We said, we need to follow the science on high potency THC, regardless of what this industry that's actually out to make profit from addiction, we need to follow the science and protect the public health. So that's what we work to do here in Colorado.
So when we passed our bill in Vermont, we had a couple of mentions of psychosis. They limited the THC to 30 for flower and 60 for concentrates. But we're talking about, in a very short period of time, a few months, we're going to open shops, recreational shops. The recreational shops will have, if this bill passes in Vermont, they're going to have no limit to THC. So why has the industry put all of their money, hired all of the lobbyists in Montpelier to try to get those limits lifted?
It's all about money, honestly. And it's disappointing as a lifelong Democrat to see Democrats being willing to side with industry and money over public health. The industry will say, oh, there's not enough research, blah, blah, blah. It's totally untrue. There is research from around the world that is calling out the alarms for the damage that high potency THC is having in our communities. And honestly, so often in states across the country, we've seen this so much over the last couple of years, the industry is the only one at the table. They have the most money, and the legislators aren't doing their homework to understand that this is a profit-driven enterprise, and the sales tax that states hope to gain from these products is nothing in comparison to the devastation that they wreak upon the next generation of your children. In Colorado, we have a very high teen suicide rate. For 15 to 19-year-olds in Colorado, 34% of the teens in Colorado that die by suicide have marijuana in their system. It's amazing to see an industry that can put whatever they want on the market without having to prove it's safe. So, for example, you can't go into a liquor store and buy vodka-soaked tampons. They don't sell them. They're dangerous. But you can go into a cannabis store and buy high-potency THC vaginal and anal suppositories. There's been no studies that show those suppositories don't cause cancer, that they could maybe don't cause infertility. Nobody knows. But they can be put on the market. They can be told that they're medicine, and our legislators are just happily looking the other way, except in Colorado. We are starting to actually pay more attention to this, but around the country, and as I watch states legalize without a genuine regulatory framework to protect the public health, it's really appalling. And it's also terrifying, because I know what is in store for the families in these states that do not understand that it is not a joint from the 1970s anymore. These are hard drug concentrates that have dramatically changed in their THC potency. Whereas in the 70s, it might have been 3 or 2% THC. Many of these products now are 80, 85% THC, 90. And they're just not the same thing anymore. They are not an innocuous plant anymore.
So the Department of Health had Professor Jonathan Calkins come and talk to us a few years ago, and a number of the legislators came and attended that. And one of the more remarkable things that he said was, he was talking about the increase in concentration of THC, and he said, it's gone up 60%. And if you don't want to say 60%, it's easily gone up 40%. If you take caffeine, like the cup of coffee that we drink in the morning, and we increase that potency of the caffeine by 40 to 60%, it's borderline lethal. And that's not, a point that people are really wrapping their heads around. And I've often thought, what would happen if they passed around 100%, 90% THC in a blowtorch, in these conference rooms where they're passing these laws? Like, how many of those legislators would be cool with that, or, would survive it?
Yeah. And how many of them would want their 18-year-olds to do it, or 21-year-olds? I feel like that is the worst part of this whole issue, is the lies that have been told to communities across the country and honestly across the world, that this is medicine, that it's safe. And I'm not saying there isn't a portion of products and THC that might possibly be medicinal, as far as the seizures, the CBD oil, the low potency products. I don't have a dog in that fight. That's not what I'm talking about. I'm talking about the things that are over 15% THC, and especially the stuff in the upwards of 60, 80, those kind of products. Humanity has not seen those kind of products created to be consumed the way they are and flavored. And then you add on it this lie, very similar to the Purdue Pharma story, that OxyContin was not addictive. It's a very similar lie now. They say it's not addictive, it's medicine, it's a plant, it's totally wonderful. And it really wasn't until, the Colorado legislature, and honestly, we have a wonderful Speaker of the House in Colorado, a Democrat from Denver, and he's a parent, and he really saw, like, wait a minute, we need to protect the public health and we need to be focused on science. And he really took this to heart and wanted to make a difference on this issue. And it was a lot of legislators who were really willing to go out on a limb, because they had heard from their own constituents and the parents that we were able to mobilize, that this is a real thing. This isn't reefer madness. This isn't craziness over not liking cannabis. This is high potency THC that is very different from what most people think they are voting on. Even with our own legislators, when we first started this effort, when we started showing them what was for sale in dispensaries and how much those products had changed over time, and then as soon as they saw the anal and vaginal suppositories, many of the legislators were like, whoa, wait a minute, this isn't what I thought it was. And we need some sort of regulatory framework that's in place to protect the public health.
Right.
And it's just disappointing, especially when you see Democratic states that have tried so hard to adhere themselves to science, to just watch them kind of toss it aside for money.
The science is kind of difficult to get your mind around, but there's a lot of research out there. And some of the Colorado psychiatrists have really done a deep dive into it. I want to show the warnings that Department of Health in Colorado is now recommending that you display.
One of the aspects of the House Bill 1317 that we passed required the state of Colorado to give out kind of a resource guide with every purchase of concentrates to anyone who purchases concentrates. And there was a rulemaking session. This was actually with the Marijuana Enforcement Division, to look at all the research and come up with what are those warnings and what should they be. Now, this has the seal of the state of Colorado on it, Colorado Department of Marijuana Enforcement Division. So the first warning is psychosis, which is psychotic symptoms, both delusions and hallucinations, visual and auditory. Then it's also mental health problems or symptoms. It's very tied to depression and anxiety. Cannabis hyperemesis syndrome, which is uncontrolled and repetitive vomiting. In fact, youth call it greening out. And then cannabis use disorder, dependence, including physical and psychological dependence. high potency THC is addictive. It is not what it was in the 70s when it was not addictive, below 5%. Now concentrates are addictive, and the state of Colorado is saying that. The state is also warning there is moderate evidence, and they define moderate as substantial earlier in the document, that individuals who use marijuana with THC concentration greater than 10% are more likely than non-users to be diagnosed with psychotic disorder such as schizophrenia. And we have parents in our group whose kids have medically been diagnosed with cannabis-induced schizophrenia, and it is extremely hard to treat. There's very few medications that work on it, and it's very different from genetic schizophrenia, which we actually have quite a few medications that work on.
Right. I remember talking to Sir Robin Murray and Dr. DeForti. We're working on a study. He said there are people who are psychotic and schizophrenic who would be well,
Yes.
but for their marijuana use. That slayed me. It was such a devastating disease and disorder, not only for the individual, but the entire sort of surrounding community that has to take care of this person. It's very, very expensive. You're saying it's addictive. And here is Vermont, the Cannabis Control Board is suggesting that they put on the labels, and they're saying it may be habit forming. And, you know, walking my dog is habit forming. Having a nice conversation with you could be habit forming. We really take issue with that terminology, and they don't mention psychosis. Actually, the law in Vermont mentions psychosis, and it says that the head of the Cannabis Control Board is tasked with finding out how much CBD needs to be added to the THC to prevent psychosis. Now, I haven't seen that covered in the CCB, or I haven't seen them convene a group of scientists to research this. We're just really impressed with what Colorado has done. You're a huge state. Think about how many psychiatrists exist, but they've just done enormous work. The Vermont Medical Society took a lot of lead from them, and this is our warning that we passed back in November. Psychosis, impaired driving, addiction, suicide attempt, uncontrolled vomiting, harm to fetus and nursing babies. And importantly, these events can happen in people who have no previous history of psychosis or mental illness. I think that's really important because there's this profound misperception that anybody who develops an addiction or a psychosis or schizophrenia, quote unquote, from marijuana is in fact was going to do it anyway.
Yeah, the industry really loves to blame people for addiction and mental health issues. We found that there's an enormous amount of blame and shame that the industry tries to use to deflect the fact that their products are dangerous. They love to say, oh, we've heard addiction is a choice. Some kids are just bad kids. This is a parenting problem. We are literally reliving what just happened with tobacco, what just happened with the opiate crisis. We are taking hook, line, and sinker the lies that this industry is pushing for profit. We've done calls with states and begged them, put money in this bill so that people can afford to save their children. It is as if we're crazy and marijuana is the answer to all problems, both physical and financial. Time is just going to have to show these states. And as more kids struggle with this issue, and you see the devastation that Colorado has been experiencing, I feel proud for the most part of the state of Colorado being willing to look now at these issues. I notice you have Representative Julia Mable up there. When we have legislators that are willing to talk about their own families and the harms that they've experienced and refuse to be shamed and silenced anymore, that's how we're going to fix this issue. But there will be a lot of lives ruined and destroyed until that happens.
That don't need to be. So I think we should listen to her, and then I'd like you to listen to a synopsis of what's happening in Vermont.
As many of you know, I have a son who started smoking marijuana in the 8th grade and then smoked marijuana consistently and persistently all through high school. And at age 18, he had his first psychotic break. And we did not know what the cause of that was, but during that time, before that happened, we had tried everything in our power to stop his marijuana use. We sent him to psychiatrists, to therapists. We grounded him, we drug tested him, we punished him, we praised him for the things that he did do, but we couldn't stop the use. Everywhere he went, this product was available and in greater and greater concentrations and potency. And after his first psychotic break, we sent him to a hospital where he spent 6 weeks, and it cost us $60,000, and they didn't fix it. They couldn't fix it. Today, he has schizoaffective disorder with co-occurring substance misuse, and he will never recover. And our family is broken as a result, and we will never be made whole. So let's not talk about him today because it's too late for him. Let's talk instead about your children and the thousands of other children that are being negatively impacted by the use of marijuana. It's a real thing. And let me just say that hundreds of parents, thousands of parents are being affected by this, and we are done being blamed and shamed into silence. We will be silent no more. And this bill gives us a voice. It says, yeah, we have to look at this. This is on us. This is what we were sent here to do. And I urge you to vote yes.
Doctors are seeing an increase in a violent illness.
Doctors there are staying vigilant of potential marijuana-related health problems.
Doctors are finding some cases where the drug itself is actually making people sick.
What these patients really have been experiencing is cannabinoid hyperemesis syndrome.
This is something that's caused by chronic marijuana use.
CHS has only been recognized for about the past decade, and nobody knows exactly how many people suffer from it.
There's concern that we will see more and more cases of CHS.
All I want to do is feel better. I don't feel like myself. I don't feel safe. Every morning I'm really just in bed gagging.
I threw up all day, every day for 14 days.
5 straight days of just throwing up every day, not being able to eat.
Man, I couldn't keep a drop of water down.
I was completely convinced that I was gonna die.
I was fighting just to stay in this world.
This is a problem and people don't know.
I didn't know it was possible that it would mess up your stomach to that extent.
Every single person I've told what this is was blown away, had no clue that it existed.
I couldn't travel, I couldn't go to work, I couldn't hang out with my friends, I couldn't eat food that I liked. It ruins everything.
For people who experienced it, it is extremely disturbing and debilitating and may be more common than we imagine.
Heat is the one thing that makes you feel better.
I was probably in the bath about 8 hours per day.
Yeah, I probably do 20 showers a day.
The water's so hot that it's scalding them.
Severely burned my back from all the showering I was doing. I was just cooking myself.
I was so desperate for relief. It is literally so much better than the pain that's in my stomach, to a point where I'd rather burn myself than deal with the pain that I have.
I've never been in so much pain in my life. I missed an entire year of work. I was so deeply in denial, I never even Googled the symptoms of cannabis hyperemesis syndrome.
People with CHS are suffering for years with symptoms and are having multiple hospitalizations and hundreds of thousands of dollars of medical bills.
Close to 20 years that I suffered without having any knowledge of CHS at all.
You tell people what you have and they don't believe it.
Nobody believes it.
Nobody believes it. They just can't understand it. Like, it's got to be something else.
He just couldn't believe. He was like, Mom, I just don't understand. They always told us pot was harmless.
I had all kinds of tests
They removed my appendix. If anything, they said that the smoking the cannabis would help.
The nurse told me about it, and I go, no. I just, that's just not true. Marijuana is completely benign. Nobody has died from marijuana. Well, it turns out that's not true either.
In his final hospitalization, he had not eaten for more than 50 days. I kept saying to them, listen, I don't think this kid's gonna make it.
People can actually die from this, and nobody takes it seriously.
This is about a 17-year-old child lost his life over something that could have easily been prevented. I want education. I was not able to save him, but I'm gonna make sure that his story is out there and some people are helped.
I want as many people as I can pretty much be educated on it.
There's people in the medical industry and in the marijuana industry who are potentially giving out advice to try and deal with this problem that could lead to somebody dying.
I thought transparency was part of the promise of legalized pot, and no one has been transparent.
We are not trying to demonize marijuana.
It is a wonder herb. It just needs to be used correctly, not abused.
We have no research. We don't know anything about it, really, because we've never studied it.
I think it's very important that we get research done so that way more people don't get sick.
Cannabis is going to be sold legally, so it must be pretty harmless, right? That is what those that sell it in your town want you to believe, because when people think a substance is relatively harmless, they use it more. This is generally the case in Vermont, which has the highest past month cannabis or THC use in the United States for both adults and teens. While people have been taught that cannabis is a harmless plant, today's high THC products come in many forms, making cannabis up to 40 times stronger than in the past. Doctors know that Vermonters want to be informed decision makers. The Vermont Medical Society reviewed the latest research. What did they find? Cannabis or THC may cause 1. Psychosis. There are numerous studies on cannabis, psychosis, and schizophrenia. Using greater than 15% THC products daily may result in 5 times the likelihood of developing psychosis and increase schizophrenia. In some cities, cannabis accounts for nearly half the new psychotic patients. In Colorado, where recreational cannabis was first legalized, emergency room visits have spiked, crowding hospitals, overburdening healthcare facilities, and increasing costs. 2. Impaired driving. 1 in 6 Vermont teen drivers say they drove under the influence of marijuana last month. Currently, 1 in 5 fatal car crashes in Vermont involve THC. 3. Addiction. The #1 state in the U.S. for substance use disorder is Colorado. Vermont is currently #2. If cannabis sellers target kids, this increases addiction. In cannabis legal states with laws like Vermont's limiting advertising, ads like this are still found without health warnings. This targeting is especially concerning since current Vermont rules say cannabis drugstores may be located as close as 500 feet from a school and right next to a daycare. 4. Suicide attempt. A review of numerous studies concluded that adolescent risk of suicide attempt increased by an average of 3.5 times with the use of cannabis, even when there is no history of mental illness. 5. Uncontrollable vomiting. A new condition known as cannabis hyperemesis syndrome, or CHS, results in extreme pain and potentially life-threatening, unrelenting, violent vomiting due to cannabis use. Rare prior to cannabis commercialization, CHS is an expensive healthcare burden doctors now see daily in busy ERs. 6. Harm to a fetus or a nursing baby. Use of marijuana during pregnancy may stunt the growth of the fetus, and these children may have higher rates of depression, hyperactivity, and inattention. Vermont doctors recommend a cap on THC of 15%, which is about 10 times as potent as marijuana of the 1970s. In Holland, where cannabis use has been prevalent for years, health and government officials propose classifying products above 15% THC as hard drugs, similar to cocaine and ecstasy. The current Vermont legislation allows for plants with THC as high as 30% and concentrates as high as 60%. The higher the THC, the more addictive and the greater the risk of physical or mental health issues, such as psychosis, addiction, suicide, or self-harm. The Vermont Medical Society recommended that these 6 warnings be added to cannabis and THC product labels and advertisements. Vermonters want to be informed decision makers.
We can finish up, Dawn, if we have a few more words. We just want to be sure everybody who feels strongly about this issue will call their House representative or senator, and the number is 802-828-2228, because right now there's a bill in Vermont that has a lot of support, which lifts the limits that we have, which are 30 and 60% THC, to have no limit on the recreational marijuana. Right now, we have no limit on medical. So if you have a medical condition, there's no limit, but they want to get rid of the limits that Vermont did put in last year when we passed the bill. So if you have concerns, or if you want the Vermont Medical Society's warnings, like they are in Colorado, to show up on the packaging, please call as well. Because right now the warnings are going to say it may be habit forming, and it will not mention psychosis, suicidality, or addiction.
It's sad to see Vermont legislators really backing away from science and public health. It will be very sad and shameful, honestly, for the Vermont legislature to bow to the demands of a for-profit industry. Usually we hope that Democrats stand with the people and with public health and science. So it's really disappointing and, like I said, shameful to see them being willing to auction off the next generation of Vermont's kids for profit, and so that they are well liked and that they get donations from the cannabis industry, both the national and the industry in Vermont. But it's a sad day to see if the Vermont legislature really turns their back on science and chooses profit and addiction over youth. And that's really what it would come down to. So I hope that doesn't happen in Vermont. I feel like Colorado is the cautionary tale. Don't do what we did here. But in Colorado, we are beginning to try and make right and do right by our next generation and change the tide. So, I hope that these other states don't have to go through the agony that our youth have had to go through and our families have had to go through. And we'll just have to wait and see. But hopefully people will learn from our mistakes here. It'll be a sad day for Vermont if they remove those caps.
The CCB is saying if we don't remove the caps, that we're going to have black market, illicit market problem. And of course, in Colorado, the promise was that if you commercialized and legalized it, you would get rid of the illicit market. Do you think the illicit market is disappeared from Colorado?
Oh my God. The illicit market is worse than it's ever been. It's almost a laughable joke. Literally every tax or regulation that the industry faces, they bully people and threaten by saying, oh, this is just going to make the black market worse. And the black market. Well, you know what? It has made the black market worse, all of these products. The black market is out of control in Colorado. And it's just a joke. And every law enforcement agency that we have talked to and met with, and they testified about this at the Capitol, said that it is not the case. Keeping a potency cap is not going to wildly destroy the state of Vermont through a black market. The high potency products will do enough on their own to destroy youth in Vermont. You don't need the black market to do it.
Dawn, I cannot thank you enough. Number one, for being concerned, for bringing your talents to this issue and deciding to spend some time with us in Vermont today. It's
Thank
very
you so
important.
much for having me.
Sure.
Take care.